The highest paying healthcare jobs in 2025 won't require touching a single patient. Here's why hospitals can't find enough qualified people. Let me guess. You became a nurse or a doctor because you genuinely wanted to help people. You studied hard, put in the hours, and mastered the skills needed to provide excellent patient care. But now, you're exhausted. The 12-hour shifts, the physical demands, the emotional drain, it's not sustainable. And deep down, you're wondering if there's a better way to use your healthcare expertise without burning yourself out. Well, I have good news. There absolutely is. And it might be the healthcare industry's best kept secret. Digital health is transforming healthcare delivery, and there's a massive shortage of people who understand both technology and clinical care. That shortage is creating incredible opportunities for nurses, doctors, and other clinicians who want to pivot their careers. But here's what most clinical professionals don't realize: your clinical knowledge is actually your biggest asset in this new world. You already have the hardest skill to find: understanding how healthcare actually works from the inside. Let me explain why this matters so much. Healthcare technology is being built at an unprecedented pace. Electronic health records, telehealth platforms, remote monitoring tools, AI diagnostic systems, they're reshaping how care is delivered. Many of these systems are being designed by people who've never worked a day in a hospital or a clinic. They don't understand the workflows, the terminology, or the real world challenges clinicians face. That's why so many healthcare IT implementations fail. The technology doesn't match the reality of healthcare delivery, and that's exactly where your opportunity lies. Companies building these digital health solutions are desperately searching for people who can bridge the gap between clinical and technical worlds. Not coding experts, but clinicians who understand how healthcare actually works. I've helped tons of nurses, doctors, and other healthcare professionals transition into these digital health roles, and here's what I've discovered. The transition is much easier than most people think. You don't need a computer science degree. You don't need years of coding experience. You just need to leverage your existing clinical knowledge and learn some foundational digital skills. Let me break down the top 3 roles that are perfect for clinical professionals making this transition. First, clinical consultant. These professionals use their healthcare background to advise on how digital systems should work in real clinical settings. They ensure the technology actually helps rather than hinders care. As a clinical consultant, you might review the workflow of a new healthcare app, pointing out that medication administration process doesn't match how nurses actually give meds. Your clinical insight prevents a major usability problem before it even launches. Second, implementation specialist. These experts help hospitals and clinics adopt new technologies successfully. They train the staff, customize systems, and ensure smooth transitions. Your clinical credibility is absolutely essential here. Imagine helping a hospital roll out a new electronic health record. Because you've worked in similar settings, you understand exactly what the nursing staff is worried about and can address their concerns in language they trust and understand. Third, clinical informaticist. These professionals translate between clinical and IT teams. They design workflows, analyze data, and help improve systems over time. As a clinical informaticist, you might analyze data showing that nurses are spending too much time documenting in a particular unit. You understand both the technical aspects of the system and the clinical realities, so you can design a better workflow that saves time. What makes these roles so attractive? They all value your clinical expertise while offering remote or hybrid work options, regular business hours, goodbye to nights, weekends, and holidays, better compensation than many clinical roles, the chance to impact healthcare at a systems level. Let's talk about the reality of this transition. When I first considered moving from direct patient care into digital health, I had so many doubts. Would my clinical skills be valued? Would I need to become a tech expert overnight? Would I be starting at the bottom of a new career ladder? The answers surprised me. Yes, my experience was incredibly valued, even more than I expected. No, I didn't need to become a coding wizard. I just needed to learn some basic digital literacy. And I actually started at a higher level than I anticipated because my healthcare experience was considered so valuable. Now let's address the elephant in the room, the skills you need to make this transition. You don't need to become a programmer or IT specialist. What you need is digital literacy. That's comfort using different software platforms and basic troubleshooting skills. Data literacy, the ability to understand and communicate insights from healthcare data. Project management skills, perhaps, organizing work and coordinating across teams. Communication skills, explaining clinical concepts to technical teams, and vice versa. The best part? These skills can be learned relatively quickly with targeted training. In my coaching program, we focus specifically on the skills that clinical professionals need to make this transition successfully. So, why aren't more clinicians making the shift? Well, three main reasons. First, most don't even know these opportunities exist. Traditional healthcare education rarely mentions these career paths. Second, many assume they need extensive technical training or another degree. That's simply not true for most positions, entry and mid level. Third, they don't have guidance on how to position their clinical experience for these new roles. The path isn't always obvious without someone showing you the way. Let me share a quick story about one of my clients. She was a physical therapist for 13 years. The understaffed hospital pushed her to the breaking point. She was physically and emotionally exhausted. She loved healthcare, but she couldn't continue with the demanding schedule and physical toll. When we worked together, she discovered her passion for improving healthcare systems and learned how to leverage her experience with digital health roles. Within months, she landed a position as a clinical consultant for a healthcare software project. She now works from home almost every day a week, makes 50% more than she did as a clinician, and hasn't missed a family dinner since. The digital transformation of healthcare isn't slowing down. If anything, it's accelerating. And the need for clinically trained professionals who understand technology will only grow. Digital health companies don't just want people who understand the theory of healthcare, they want people who've lived it. People who know what it's like to work 12-hour shift and to navigate chaotic emergency department, to coordinate care across multiple specialists. That's knowledge you can't learn from a textbook, and it makes you incredibly valuable in this healthcare landscape. So let's circle back to where we started. The highest paying healthcare jobs in 2025 won't require touching a single patient, not because patient care isn't important, but because your clinical expertise can have an even bigger impact when applied to digital health solutions that reach thousands or millions of patients. The shortage of qualified people isn't because these roles require rare technical skills. It's because most clinicians don't realize they're already qualified for these positions with just a few additional skills. Your clinical background isn't just relevant in digital health, it's your superpower. It's what sets you apart from traditional tech professionals who don't understand healthcare from the inside. If you're feeling burnt out, if you're missing important family events because of your schedule, if you're wondering if there's a better way to use your healthcare expertise, there is, and you don't have to leave healthcare behind to find it. Digital health needs your unique perspective. Your experience at the bedside is exactly what will make digital health solutions actually work in real life. If you're ready to explore how your clinical background can launch you into the world of digital health, I've created a free resource guide that outlines the top 5 entry points for clinicians. Just click the link in the description or drop a comment with digital, and I'll send it your way. Remember, your clinical expertise is valuable beyond the bedside. It might be time for you to use it in a way that gives you back control of your life while still making a massive impact on healthcare. Thanks for watching. I'll see you in the next video